My name is Dr. A.K. Debdas. I practice in Jamshedpur. I used to be attached to the local MGM Medical College. And here is my message to all mature girls and young women about PCOD, which means Polycystic ovarian disease, which is the ultrasound diagnosis. This is becoming very common. Is found in 20 to 30% of young women today. The most disturbing symptom for a woman or girl in this condition is appearance of facial hair. And second very important disturbing feature is not being, if they are married, not being able to get pregnant. That's called infertility. Now the cause of this disease is not yet known. Intense research is going on. So my advice to all young women and girls, these are the things which they can do to avoid having PCOD or to manage it well. So first is, please note, though the disease is not curable currently, but we can very effectively treat all its odd features like facial hair, irregular nails, not being able to get pregnant. So there is nothing drastic to worry about. Now, the other thing we must remember that PCOD is body weight related. So make sure you don't put on weight. For that you have to go on a diet and do regular exercise. You may use some exercising machine or walking. And buy a weighing machine and take your weight once a week, and that will be like thermometer, tell you whether you are putting on weight or you are okay. Keep a menstrual calendar in a sheet. Write down the first day of mens and keep writing first day, and the gap between them, so that you know your cycle, whether it's still bad or getting better. Avoid all fast food like burger, chips, pizza, etc. And have a high fiber diet, a lot of vegetables and fruits. Drink a lot of water. But your main meter will be your weighing machine. So that's all you can do for yourself to avoid PCOD or to control it.